Welcome to the webinar, Teaching Learners to Practice Mindfully in a Turbulent Healthcare Environment. Hi, I'm Barbara Lewis, the Managing Editor of .com, an online communication skills learning management system for hospitals, medical schools, and residency, PA, and NP programs. Joining me today is an expert in this field and the author of .com's Module 2 on mindfulness and reflection in clinical training and practice, and the author of Attending Medicine, Mindfulness, and Humidity, Dr. Ronald Epstein. Welcome, Ron.
Pleased to be here, and welcome to everyone who is able to join us. Today it will be a brief taste of how reflection and mindfulness can help you as a teacher and as a clinician. And I'll address briefly 4 areas. First of all, what is mindful practice, why it matters, how to cultivate more mindful practitioners, and also being a mindful teacher. And again, this is just an introduction, and I'll give you some information about where to go to for more. Mindful practice I defined back in 1999 in an article in JAMA as really familiarizing yourself with your own inner life. It is a moment-to-moment purposeful attentiveness to your own mental and physical processes during everyday work with the goal of practicing with greater clarity and compassion. I've defined 4 key areas of mindful practice that are amenable to learning and also are useful for clinicians: the ability to observe attentively, to be critically curious, to adopt a beginner's mind, and to be present. And I'll go through what each of these really translates as in your lives as clinicians. The first is attentive observation. And one of my favorite philosophers, Yogi Berra, once said, you can observe a lot just by watching. And I think it's really true. Often we don't know to look for that which we don't necessarily expect. And another great philosopher, this time physician, William Osler, said that we miss more by not seeing than by not knowing. And I think this is also important. By the time you finish your medical training, often you have a vast repository of knowledge, but you don't know when and how to use it, and also how to apply it to situations that are immediately at hand. So this was you've probably all seen the gorilla video or heard it described, where there's a group of people tossing a basketball around, and a gorilla walks across the visual field, but you don't notice it because you're so attentive and so focused on watching this basketball go back and forth. Well, just to bring it a little bit closer to home, this was a CT scan that was inserted in a whole pile of CT scans that a group of radiologists were reading. This was a study that was done a number of years ago. And in one of the images, they inserted this little gorilla in the right lung field, and they actually had sophisticated eye tracking technology to see where the radiologists were actually looking when they looked at this series of CT scans, and virtually all of them looked at the gorilla, but only a third actually reported that they saw something more unusual. And if you didn't see it on the previous image, here it is kind of just brought into greater contrast. But this raises really fundamental questions about what we pay attention to, what we tend to notice, what we notice about ourselves, about things, and about others, and also how do we notice? That is, what are the mental mechanisms that we employ when we're noticing something? What do we exclude from our field of vision? And also, with all of the stimuli coming at us all at once, how do we choose from among competing sources for our attention? Just to bring this into a practical area, I've done a lot of audio recording of patient-physician interactions, and it's uncanny how when patients present a physical symptom, that physicians latch onto that very quickly, but as soon as the symptom is in the emotional or psychological domain, most physicians tend to act as if it just flew right by them, not noticing. I think it's part of our training that we are inculcated to notice certain things and consider them relevant. Consider someone who says that they have pain exactly in a particular location as opposed to a patient who says, I hurt all over. again, think about how you react to those two presentations and what you pay more close attention to. So this has some neurobiological basis that's been uncovered over the past 25 or 30 years. But just to make it all simpler, there are three ways in which we pay attention. One is this focused attention when we're looking for something and clearly are goal-directed. So we call this top-down attention. It's effortful, it's vigilance for the expected. You're in the operating room, you expect to see a certain structure, and sure enough, you're looking for it, and even before you see it, you're constructing a mental image of what you might find. Or if you're driving to work, there's a familiar place where there's a stop sign, and it's as if you see the stop sign before you even see it. Bottom-up attention is alerting to the unexpected. So you're driving to work along that same road and a deer jumps in front of your car. Or if you're in a big city, a pedestrian or something unexpected. And before you even notice what that object was, your foot is on the brake. And that's well-functioning bottom-up attention. But we've all seen examples where something that was perfectly obvious in retrospect actually escaped our attention because we weren't looking for it, and our bottom-up attention wasn't adequately well-tuned. And executive attention is like the example that I pointed to before, where a patient's recounting a set of symptoms, and certain ones grab your attention up, and other ones pass you right by. And it may depend upon your specialty, how you were trained, and also what that patient has presented to you in the past. If it's someone who's always had a long litany of unexplained somatic concerns, then then they present yet another symptom, you may be tempted to assume that it's just another unexplained somatic concern and not a harbinger of something more serious. So just a story. When I was a medical student, I worked with a neurologist, a Dr. Fisher, well-known. And I noticed that one night I was late finishing my notes, and there he was in the darkened room of a patient, shining a flashlight on his face and kind of making all sorts of grotesque facial gestures and sounds. And now this was a very distinguished, elderly, senior clinician, and this was utterly bizarre behavior. And so I was just kind of wondering, why was he doing this? And I looked at the name on the door and looked in the room, and sure enough, this was a patient who had been admitted a few days ago with a basilar stroke and appeared to be locked in. His family noticed, the patient's family noticed that they thought they saw a flicker of an eye movement to indicate that the patient may have some way of communicating with the outside world, but none of the clinicians actually were able to replicate that. And Fisher was there because he was curious, he was interested, he wanted to find out, he wanted to know more about this patient and to see really if there was some way that he was able to communicate his needs to the outside world, and was doing all of this to try to get the patient's attention, to try to get a reaction. And ultimately actually did succeed. But it was this act of not just saying this is a patient who otherwise had a poor prognosis and walking to the next room, but had an intrinsic curiosity. And that curiosity translates into basically every field of medicine you might be in, whether you're a radiologist or a pathologist or a family doctor or a dermatologist. Having a deep interest in people is really one of the prerequisites for practicing mindfully. When I was younger, I took up a practice of Zen meditation and spent some time at a Zen center in California. And the guy who founded the center, Shimiru Suzuki, was known to talk a lot about this concept of beginner's mind, and would say things like, in the beginner's mind, the possibilities are many, and in the expert's mind, there are few. And it's not saying that when you're an expert, you should throw away your expertise, but expertise carries with it a certain risk, a certain set of preconceptions, a sense that you understand how the world is structured, and may actually put you at greater risk for not seeing those things that are different, unusual, and surprising. Many of you probably had the experience of working with a medical student or a resident, a bright medical student or a resident, and they suddenly kind of ask you on rounds something like, well, why'd you do that? And then suddenly you stop and think, well, why did I do that? And sometimes it's the eyes of a beginner that enable you to see yourself in a different way. Well, adopting a beginner's mind is kind of like that. It's the ability to see yourself as others see you, to think about your own thinking, to kind of step outside of yourself, to set your expertise aside so you can see a situation afresh with new eyes, with a new perspective. And so these are just some qualities of people with a beginner's mind. They're able to hold contradictory truths simultaneously. Yes, this patient is non-adherent, and yes, the same patient is trying as hard as she can. I mean, just holding those two perspectives at the same time. Seeing information as novel, seeing facts, things that you take for granted, as conditional. Feeling that sometimes that your mind doesn't need to be full. In fact, if your mind is filled up, sometimes it's harder to learn something. So to appreciate the value of emptiness and not knowing. I've heard it said that the difference between an expert and a master is that experts know all the answers and masters ask the best questions. So again, another Zen parable. Two monks were watching a flag flapping in the wind. One said to the other, "The flag is moving." The other replied, "The wind is moving." And Wei-Neng, their teacher, heard this and said, "Not the flag, not the wind, mind is moving." I think there's tremendous wisdom there, the ability to allow your own mind to move between two different views of the world. And then finally, presence. And patients will tell you, you'll ask them what they like about their doctor, and they'll say something, well, he or she was really there for me. Now, what does that really there mean? What is presence? And there's really very little written in the medical literature about presence. But distilling it down, it has to do with knowing you as a person. It has to do with not being thrown off kilter, so a certain degree of mental stability, emotional engagement. When there's something unpleasant or difficult to deal with, someone who's present turns towards that dissonance as opposed to away from. And it's my belief that that kind of presence is actually one of the most important ingredients of being compassionate. That it's hard to be compassionate unless you're actually really there and really present. You can't be at a distance. And skills, again, these things are things that can be learned. You can learn to be present. Performing musicians learn this all the time. Competitive tennis players practice presence. My daughter is an equestrian. She has to be present when she's jumping over a 4-foot fence on a horse. Otherwise, bad things happen. So it's knowing when you're out of the box. It's knowing how to slow down when you should. And in psychological terms, it's experiencing that space between a stimulus and a response, where you really have a choice about how you want to react to a certain circumstance. So why practice mindfulness, and why consider mindful practice as one of the core skills of being a good physician? And it really boils down to 3 areas that by being mindful, the hope is that you would be more attentive and therefore practice more safely, more effective, and more timely care. So it's really a quality of care issue. It has to do with quality of caring, the quality of the relationships that you form with your patients and with your colleagues. So qualities of empathy, of compassion, responsiveness, patient-centeredness. And increasingly, research seems to point that these are all related to the quality of one's own well-being as a clinician, your mood, your level of burnout, your level of resilience, and the degree to which you feel that you're flourishing in the work that you're doing. I've often asked what the opposite of burnout is, and I don't think it's just being happy. I think it really has to do with being fully engaged in the work you do and feeling a sense of flourishing, not just a sense of well-being. So we all have a zone within which we work optimally. And when we're not too relaxed, too bored, too anxious, or too excited, and you can fill in the blanks with other emotional states that really affect you. And this is something that I learned first in my early life. I was a performing musician, is that when you're a performer, you don't ever really get over stage fright. You learn to perform well in spite of that stage fright. And I think that the same thing is true for clinicians, that part of medical training is that you learn how to practice effectively when you're dealing with something incredibly routine that you've done thousands of times before that otherwise might bore you. You learn to practice well when you're feeling anxious. You're learning to practice well when you're excited about something or when you're holding on to a particular idea. So that expansion of your optimum work zone is what goes along with being mindful. I just want to take a moment to talk a little bit about the clinician well-being portion of this, because again, increasingly it's appearing that clinician distress matters not just to the well-being of clinicians, of us, but also in terms of the quality of care and quality of relationships that we have with our patients. And so here's just a list of some research findings culled over the years and that are directly related to self-reports of clinician distress. And as I mentioned before, the goal is to move from this feeling of burnout, of feeling emotionally exhausted, a feeling that you're treating others as objects, feeling ineffective in what you're doing, to a sense that you're more resilient and more flourishing. But I think this also goes deeper, and being mindful is not just simply about being more effective in the world. It's also feeling a greater sense of integration, of knowing yourself and bringing your whole self to your work and not leaving parts of yourself in the parking lot or at home or in some other part of your life. And the ability to bring those as appropriate to the care of patients. So if it's your sense of humor or your ability to share grief, or if it's your ability to be humble, if those are things that you don't have access to in your life as a clinician, then your work is in some ways more impoverished. I've been teaching about mindful practice with the idea that a lot of these are not innate things that you are genetically determined or things that are determined by your childhood and upbringing, but in fact are things that you can learn. And here I have to speak a bit from my personal experience, as well as more general principles, that I think that for clinicians and anyone involved in intense interpersonal work, finding some space within your life to reflect, to be quiet, to set aside as time just for you to take stock of what's going on in your mind, to know yourself better, is an incredible gift. And it's a gift not only to yourself, but also those you care for. So whether it's formal meditation or something else that you find, finding those spaces during the day are nourishing, and you don't need much. I mean, this is partially in jest, 2 minutes twice daily, increase as tolerated. But think about, what is it that you could do on a daily basis that you can set aside a moment to just be with yourself? To not do anything, to not try to be calm or relaxed or happy or sad, but just to be with yourself, to take stock of where you are right now. Perhaps ask yourself, what's my state of well-being right now? What do I find most meaningful? How burned out am I? So these are questions that you could begin to discover as you know yourself better. For me personally, meditation has been very useful. We incorporate meditation into the teaching that we do for medical students here and residents and practicing physicians. I think most people find that even if they're not going to take it on as a habitual practice, that they find those moments having some value. But you can do things during your workday that I would call informal practices. And I call them practices because they're things that you need to practice. So for example, let's say you decide that for the next week, every time you touch the doorknob of a room that you're about to go into and see a patient, that you'll stop momentarily, take a breath, be still for a moment, and then continue on. And maybe you'll decide to set aside what's happened in the previous room with the previous patient. Kind of set it on an imaginary shelf, accessible, so you can have access to it whenever you want, but that it's not cluttering your mind, so you're fresh and available. Or another practice, it's a simple practice. Every patient that you see, find something about that person that you can say, that's just like me. Okay? You can say, this person has fears just like me, or this person wants love just like me, or this person has pressing questions about their life just like me. Another way of being mindful and connected. Becoming aware is difficult. So we all know what the late warning signs of stress are, when life really is out of kilter, but trying to be mindful of the earliest signs of stress. So what happens to you? Do your teeth clench? Does your neck tense up? Do you curl your toes? Do you feel a growling in your stomach? Do you feel a headache coming on? Because those are really useful signs of stress, and then you can begin to do something about it before they get out of hand. And if this were a workshop, we would have you discuss this with a partner. This is something that you can do while you're seeing patients, or if you're teaching, you can do on rounds. These are ways of getting yourself outside yourself, what I call cultivating the observing self. Ask yourself, if it seems like something, let's say it's flu season and you've seen 20 people with flu today already, and number 21 is coming in. What's new and unique about this patient? What are you assuming that might not be true? Are there things that you're presenting as fact that aren't quite so clear? What would a trusted peer say? And these are questions that I actually use on rounds with learners. I'll say, well, what do you think is going on? And they'll say, well, what are you assuming here that might not be true? And it gets people to think inside themselves about, well, maybe there is another possibility here. Maybe this is not flu. I use a lot of narrative exercises. Again, this is a classroom kind of thing rather than on the wards or in the moment of seeing patients. And this one's about meaningful experiences with a patient or colleague. Now, it's useful to consider narratives not only about positive experiences, but also negative experiences. And they both have their value. But the real value in doing this is the capacity for telling those stories in the context of someone else who's able to listen deeply and help you be aware of your own responses to a situation. These are instructions that we would give to a listener, to spend most of their time listening, be curious, ask questions that aim to deepen understanding, but to set aside your own need to interpret, give advice, or talk about yourself. A good principle for life in general. And the questions that you ask may serve to identify difficulties that the storyteller is saying, but you may also use that as an opportunity to strengthen an individual's capacity to apprehend and anticipate and heighten their positive potential by asking about what things went well, what things were you most effective at, what things gave you the greatest meaning. And so in these circumstances, if you do it as an interview or a narrative exercise, you try to identify difficult moments in which you performed well when you were at your best, and then identify those and reflect on how those attributes might be applied in future situations. And again, a list of themes that you could address with learners, that enable them to be mindful in a variety of circumstances. You don't do this all at once. This would be a series of seminars or workshops or opportunities that you'd have during their educational career. Briefly, we did study this using formal and informal practices, narrative and appreciative inquiry with primary care physicians about 10 years ago now. And again, you can read this on your own time. And there have been a number of other studies since that document that not only these exercises that promote mindfulness improve clinicians' sense of well-being and decrease burnout, but it also enables them to be more empathic and take more patient-centered and pro-social attitudes in their care of patients. So in summary, in about 20 years of doing work helping clinicians be more mindful in the service of providing better care of their patients, just a few basic principles in closing. It's important to be there, to have an intention to learn from within as well as to learn from the outside, recognizing that you can learn to pay attention to the right things, qualities of deep listening, and also the need for practice. It's like learning to play the piano. Deep listening is not something that we learn without practicing. We have to do it over and over and over again. And also there's something different between practicing in a classroom environment and being in a performance environment. Any musician will tell you that. And as clinicians, our performance theater, if you will, is the examination room, is the operating room. And so bringing those skills that you have, that you may already have in your everyday life, to your work setting is crucial. Building community is important, and especially important is giving yourself permission to develop yourself further in the service of being there for others. This is hard for us as clinicians. We're so other-focused. So I just wanted to draw your attention to other resources. I moved very quickly through these things. The references for everything that I've mentioned would be on the Mindful Practice website and also in the references in the book that just came out. And you can find out more about this work by going to my website, which is listed on the bottom. Again, I appreciate the opportunity to be with you for this brief half hour, and I'd welcome any questions or discussion at this point. And you can type into your little chat box for that purpose.
Oh, thank you, Ron. That was all just great information and advice and absolutely fascinating. We really appreciate it. So .com plans to host webinars each month, and you can sign up for our March webinar on using .com for residency programs. And this is where .com is assigned in March, right after the match for interns. This webinar recording and PowerPoint will be posted on our website, and you can view all of our other webinars as well. If you'd like to tour .com and learn a little more about Module 2 on mindfulness, here is a code for you to use for a 30-day trial subscription. And please, as you're exiting, fill out our survey. Tell us what you thought about this webinar and any suggestions for future topics. Thanks again, Ron, and thank you for everybody for joining us today.